Hi, I was recently asked about my congenital hip dysplasia and how that played into grafting and reconstruction of my left hip, so I want to share with you. As a child, I had congenital hip dysplasia. The worst side was the left. So 34 years ago, I had both hip joints replaced. Now, 4 years ago, I was looking at grafting and reconstruction of this left hip. I did not want to even think about that. And the downtime, the pain, none of that. So, I had an opportunity to have a raindrop massage, and that's a massage with a series of oils placed on the feet and the spine, and that just opens up neurological pathways and your body just starts healing. It's an amazing technique. I'd also added Ningxia Red, BLM, Angeles, and sulfurzyme to the regimen that I was using. I noticed a difference. I went to the doctor and I canceled my surgery. He reminded me that it would take 2 weeks for me to get in if that hip broke. I understood. I told him I'd also stopped the Celebrex. He was glad of that. Now I'm on a walker during this time, and I'm working, and it was a few weeks before I graduated to a cane. I continued the regimen. I went back the next year in December, and he said, well, continue doing what you're doing. And I continued on my cane. And then my patients that I treated even noticed a difference. They were saying, oh, you're walking better. And I said, yes, I'm not depending on this cane as much as I was. So the following year I went back. He, of course, does x-rays every time. He came in and his first words were, remarkable. And I reminded him that we serve an awesome God, and he agreed. I told him the regimen that I had been using, and he said, you are no longer eligible for surgery. I'll see you in 2 years. Now, 16 months of that 2 years is gone, and I'm kind of anxious for December to roll around to see what he says. But I've ditched the cane from when I'm in the office or around the house. If I am going for a long walk, I will take it with me for support because this left side has always been shorter than the other, and that makes me tire out. But recently, we went to the Cincinnati Zoo with grandchildren. I walked 6 miles that day. I did not have any pain in my hips at all. Amazing. The grandchildren were complaining about their feet, and I said, Granny's still going. But I attribute this, of course, to God's grace, but also the great products that we have with Young Living. The Ningxia Red for me, is an anti-inflammatory. It just keeps that inflammation level down because I do have arthritis. And Angeles does just what it says. It keeps the joints moving. The BLM is bone, ligament, and muscle support. And the sulfurzyme has MSM in it, which is a major component in cushioning of the joints. Now, periodically, I will use CBD cinnamon oil, and I just drop that under my tongue. And I'm trying to figure out for sure if that's what I'm feeling, where more strengthening is coming. I've also added SuperCal Plus. It's an amazing vitamin calcium supplement that Young Living has. You take 2 of those a day. So it's a lot of pills, a lot of supplements, but our supplements are enhanced with essential oils. So we get a so much better absorption rate. I'm told the research has found that we get as much as 80% absorption with our supplements in Young Living as opposed to 30 to 40% of products over the counter. Plus, we have the guarantee of the purity of our supplements. If you have any questions, I'd be glad to help you. Try to figure out a regimen for you, what works. You may not need all. Some of those, like BLM, I've stopped for the time being. So you just kind of have to play with it and see how you do. And if your body doesn't respond correctly, then you just add it back in or change it for something else. I sometimes will use Panaway if I'm having some topical discomfort, but usually that's in my shoulders and not in my hips at all. So if you have any questions, reach out and I'll be glad to help you. Thank you.